As we've heard this morning from Pete Peterson and Michael Peterson and, of course, President Clinton, addressing America's long-term debt is one of the most difficult and most important issues facing policymakers today. In this session right now, we speak with two of the leading Washington authorities on economic policy, Congressman Paul Ryan, the chairman of the House Budget Committee, and Gene Sperling, the director of President Obama's National Economic Council. And before I bring Chairman Ryan out, last month, the chairman introduced a proposal to reduce long-term deficits without raising taxes. The plan proposed significant changes to the Medicare program, Medicaid, as well as other cuts in federal spending. Some people have hailed the program as quite positive, others have criticized it. Let me bring on Mr. Ryan as he soldiers on, and he will talk to us about that plan. Congressman Ryan.
Thank you. Sorry, I got caught up with President Clinton.
Yeah, I saw that. Congressman Ryan, we're great to have you today, and we will talk with you about your plan, and then, of course, get Gene Sperling's comments on the White House plan. So your plan to cut deficits includes cutting spending by $5.8 trillion. You do not accept any tax increases on the revenue side, reducing budget deficits by $1.6 trillion.
4.4 over the 10 years.
Over the 10 years, that is included not increasing any extra revenue from tax increases, which is from Gene Sperling's plan. The proposal calls for fundamental restructuring of Medicaid and Medicare. So let's start right there. Can you walk us through what Medicare and Medicaid changes look like over this 10-year period and beyond?
Well, so over the 10-year period, no changes to Medicare. Medicaid over the 10-year period, what we're doing is basically taking a page out of the successful welfare reform policies of the 1990s that President Clinton signed into law, and we're sort of replicating those strategies to other parts of law, Medicaid in particular. With Medicaid, we're proposing to block grant the program back to the states and grow the program at a more sustainable rate. Medicaid's broken. Throwing more money at a broken system we've proven doesn't work. So we grow it at population plus inflation, population growth plus inflation. But more importantly, from talking to dozens of governors, we're giving them the freedom and the flexibility to customize Medicaid to meet the needs of their particular populations. In Wisconsin, we think we have a better way of doing it than, say, maybe New York or Nevada. And so we want to empower the states with the ability, because they already manage the program, but they get a lot of federal strings. We have successful programs that take years of getting waivers, block granting to the states, and let them customize it to meet the needs of their particular populations. Now, Medicare, we propose, and this is a little lost in some of the TV ads you hear these days, we propose to not change the benefits for people above the age of 55. More to the point, unlike the President's health care law, which takes $500 billion from Medicare, not to extend its solvency, but to spend it on the President's health care law, they also have a board called the IPAB, which is designed to sort of impact price controls. We repeal that board because that affects current seniors. We've recently heard some startling announcements from the actuaries at Medicare and what that would actually end up doing. We get rid of that. We make sure that any money coming from Medicare goes to saving and making it solvent. And we say for people 54 and below, because grant you, CBO is telling us Medicare is going insolvent in 9 years. The trustees moved up by 5 years the date at which it goes insolvent. It's collapsing. And in order to keep the promise to current seniors, people in and near retirement, who've organized their lives around this program, you have to reform it for the next generation. So for those of us who are below 54, we say move it toward a premium support system. That's the same kind of system that President Clinton's Bipartisan Commission to Save Medicare recommended. It's an idea that has had lots of bipartisan support in the past, and it would work like this. Medicare will go out and negotiate with insurers and have guaranteed coverage options from which then seniors will choose from. Medicare will subsidize their premiums, and it would do it like this. More for the poor, more for the sick and the middle-income person than for the wealthy person. Less subsidy for a wealthy person and more for those who have less money. Doing it that way, harnessing the power of choice and competition, and subsidizing those with less with more and subsidizing those with more with less, makes Medicare solvent, makes it secure, and gives us the ability to keep the program as it's currently designed for those who are in retirement and 10 years away from retiring.
We want to talk about health care as well as the other areas that require delving into, such as defense spending and tax reform and other federal spending cuts that you've proposed. But let's stay on health care because I have a follow-up on seniors. The CBO says that your health plan would increase total health spending for a typical 65-year-old Medicare beneficiary by 30 to 40% in 2030, because the private plans that replace Medicare under your plan would have higher administrative costs and less negotiating leverage with providers than the current Medicare program does. Why do you think that shifting Medicare beneficiaries to a fragmented system of private payers would reduce total costs?
Because experience shows us that it's working. I would disagree with the premise of that question, number one. Number two, measuring any Medicare reform plan against the status quo is to measure against a fiscal fantasy. We have tens of trillions of dollars of unfunded liability with Medicare. It's growing at an unsustainable rate, which is ultimately the biggest driver of our debt. Even President Obama acknowledges that with his cap on growth rate of Medicare using the IPAB. We do it a different way. But more to the point is we have experience. Medicare was written in 1965. It pays for brain surgery. It basically is a price-controlling kind of a system that dictates the kinds of prices for bedpans and brain surgery. That's what John Breaux always likes to say. The point we're saying is use choice and competition and have these plans compete against each other for the beneficiary's business in the future. Okay, where do we have experience with this? This is how the federal employee plan works. This is exactly how the Medicare drug benefit plan works. So we're saying move it to a system that works like the drug benefit plan. And what is the evidence? What is time and reality shown us? This is a plan that came in 41% below cost projections. So Medicare drug benefits, which work this way that we're proposing, cost 41% less than we originally thought it would because of choice and competition. It's very popular, and here's the key. It's the senior who gets to choose. And if she doesn't like the plan she has this year, she can fire that plan and go to another plan next year, and they know that, so they have to compete against each other on quality, on price, and using those market-based principles of choice and competition where the power comes to the senior, not to a government bureaucracy, helps us improve this system and lower costs. Now, monopolies don't work, I would say, whether it's an insurance monopoly or a government monopoly. We want to break that up and put the power in the hands of the person, not in some 15 unelected bureaucrats to determine how this very complicated sector of our economy works.
How do we know that doctors and hospitals will be willing to treat Medicare patients under your plan if their reimbursements are lower? So take a look at the current status quo. The trustees just gave us a new report saying that they believe about 40% of Medicare providers will stop taking Medicare patients under the status quo, under the current path we are on. Under the President's plan, they think more providers will stop taking patients because of price controlling. Medicaid is a problem in the same vein, where providers are taking less and less Medicaid patients because of under-reimbursements. Under the program we're talking about, we're not saying price control, we're saying choice and competition. So providers are incentivized and rewarded for actually excelling and innovating and creating a better service at a lower cost. We want to have the patient-doctor relationship be the driver and the nucleus of the healthcare system, not a government price control system. And so I would argue that providers are going to be under more stress and more strain under a price-controlled system than under a market-based system where the power really goes to the person to select among competing providers for their benefits. I want to move on to tax reform and Social Security, but one more question on the Medicare plan. The CBO says that your Medicare plan could more than double seniors' out-of-pocket costs. Is it realistic to assume that most seniors would be able to afford those cost increases?
A couple of things on that analysis. Number one, it fails to take into consideration the extra $7,800 we're talking about adding to low-income seniors' benefits. So what we're saying is protect those who are low income by supplementing their benefits and covering their out-of-pocket costs. We're also saying as people get sicker, increase their payments to stabilize their premiums, and as people get wealthier, don't subsidize them as much. So it's really inaccurate to suggest that that's going to happen to everybody. But the other thing I would say is it's comparing Medicare to a fiscal fantasy, which is the current system is unsustainable and it's growing at rates that are unsustainable that will crash the system. And so the question is, what are the kinds of reforms we're putting in place to get at the root cause of health inflation, to make our healthcare dollars stretch farther, to inject competition into the system so we can stretch our dollar farther, and then subsidize people more who need it more and not those who need it less. And so it's really kind of an incomplete comparison to suggest that that's happening to everybody. Yes, wealthier people are going to pay more in the future, but more importantly, there's only so much money to go around. It's finite. And what we believe we should do is save Medicare so it's something that the next generation can count on, and subsidize people who need it the most and not as much people who need it the least.
We have questions from the audience as well as from Twitter on this particular part of the plan. But let me ask you about tax reform. We just heard President Clinton talk about the fact that it is very difficult to see how this plan would work without any new revenue. You are against raising taxes, and some people say that's really an ideology.
Yeah.
That you are just against any tax increase. How will this work without increasing revenue?
I wouldn't call it ideology, I'd just call it economics. And here's the missing ingredient in this conversation. If we allow this debt conversation to be one of mathematics and green eye shade, the missing ingredient is economic growth, is job creation. The two basic things we're trying to accomplish here are spending cuts and reforms and economic growth. Under the President's plan, the top tax rate on individuals goes to 44.8%. We don't agree with that. We don't think we should be raising tax rates. We don't think we should be taxing our employers and our job creators more than our foreign competitors tax theirs. And so we're not actually talking about cutting tax revenues, we're talking about tax reform. Just like the Fiscal Commission recommended. Broaden the tax base, lower the tax rates so we have a more flatter, fair, more internationally competitive tax system with an eye on economic growth. Do we want more revenues coming in to help close our fiscal gap? Of course we do. The way in which we think the best way to go after that is economic growth and job creation. Cranking up tax rates, I don't think is going to accomplish that. It's actually going to be counterproductive because I believe in this era of global competition, it's going to make our economy much less competitive. Most of the jobs, at least where I come from successful small businesses who file their taxes as individuals, as sub-S corporations, partnerships, LLCs. When you're bringing their tax rate, along with their state taxes, above 50%, that's going to put a chilling effect on hiring and job creation. On the corporate side, we have the highest tax rate in the industrialized world. The average industrialized world tax rate is 25%. Ours is at 35%. Some companies have a very low effective tax rate. Some companies have a really high one. We're saying clear out the clutter, all the tax expenditures, lower the tax rates on everybody so it's more internationally competitive with an eye toward job creation. And so under the guise that we're talking about, the person and the business that make the same amount of income should basically pay the same tax rate. That's not the system we have today. We need to clean it up with an eye toward economic growth. And with economic growth, you get better revenue growth.
What are some of the low-hanging fruit, if you will, in terms of these tax expenditures that can go away and ultimately lead to expanding the base, the broader base of tax?
So this is exactly what the Ways and Means Committee is intending on moving through on this summer and putting plans out there. We're literally in the midst of doing our research and our hearings in the Ways and Means Committee to do just that. And we're talking about taking a page out of the playbook of the Fiscal Commission. We have more room to maneuver on tax expenditures than the Fiscal Commission because our revenue targets are a little lower than the Fiscal Commission's revenue targets. And so we have to have a conversation with ourselves and then with Congress and the country about which of these tax shelters should be going away in exchange for lower rates. I would simply say, for those who choose to use class warfare in describing these things, the people and the companies who use tax shelters are those in the top tax brackets. And for every dollar that's parked in a tax shelter, that dollar is taxed at zero. You get rid of the tax shelter in exchange for lower rates for everybody, you're actually taxing that money. And so you're just having a broader base, flatter, simpler system, and more people are actually paying taxes on money that they weren't actually paying taxes on before. We just think it's a smarter way to go. We think it puts us in a better position in the global economy to lead and to create jobs. And I'll just finish what I started with. We got to keep an eye on international competition. And when we tax ourselves a whole lot more than our foreign competitors tax themselves, we're going to cost ourselves competitively. And you can't fix this fiscal problem if you can't grow the economy.
This plan did not talk about Social Security, restructuring Social Security. You've talked about it before, right, but it is not part of this plan. I wonder if you had dealt with Social Security, that perhaps you would not have to have some of the other spending cuts that you're talking about on education, food stamps, cutting services on the people who desperately need those services?
So if we had done a Social Security plan, and I have several bills that I've introduced in the past to do Social Security, I believe in reflecting longevity, a more progressive benefit structure. It still wouldn't have accumulated savings in the 10-year window because, like Medicare, we would have exempted people 55 and above from any changes. The reason we put a Social Security trigger in this bill, saying if Social Security is going insolvent, which it is, House and the Senate and the White House need to submit plans, was we actually, maybe naively so, thought we would have a better chance of getting a Social Security agreement this summer with our partners on the other side of the aisle. We believe that if we put a Social Security plan out there, it would be too tempting for Harry Reid and Nancy Pelosi to demagogue it, just like they're doing on Medicare, running all these Medicare campaigns. We figured they would do that on Social Security and make it harder to get a Social Security agreement. So what we wanted to do was make it such that we had a higher likelihood of actually reforming Social Security, because I fundamentally believe if we can reform at least one of our unsustainable entitlement programs, that would help us a lot with the credit markets, with the economy. But unfortunately, we don't seem to have any interest on the other side of the aisle to do any of that. Now, with respect to those safety net programs you talked about, we're simply bringing spending back to where it was just a couple of years ago, growing them more sustainably. Social welfare spending still increases in our budget, but at a more sustainable rate. The safety net is fraying at the edges. And the way in which we choose to reform the safety net is to take a page out of the playbook from the 1990s, the successful welfare reform that President Clinton signed into law. We want to use those elements, those ideas, and apply it to the other welfare programs. That reformed one welfare program. There's still dozens left that were unreformed. And the idea we have behind our safety net reforms is we want to have a safety net that is there to catch people who are slipping through the cracks, to help people when they're down on their luck, and to help people who truly can't help themselves. But we don't want the safety net to be geared toward keeping people on welfare. We want the safety net geared toward getting people back onto their feet onto lives of self-sufficiency. This is why we proposed to consolidate dozens of job training programs into career scholarships to go to workers who are in displaced industries so they can go back to school, get new skills and new trades so they can get back into a career and on their feet. So we're not talking about just green eye shade here. We're talking about saving and transforming the safety net to get people back to work, fulfilling the mission of health and retirement security, saving these programs, paying off our debt, and most importantly, economic growth and job creation. Those are the four things we're seeking to achieve with our budget.
Defense spending. Where are the opportunities to cut defense?
I think Secretary Gates has done a very good job. He's gone through and identified $178 billion in cuts that he believes could occur in the defense. We agree with that, and we accepted those cuts. He recommended taking $100 billion to go to the troops, to modernize their weapons and their equipment that are needed, and then $78 billion for deficit reduction. That was what President Obama proposed in his budget, and we agree with that. The other point I want to make, and Republicans are of a mixed opinion on this issue, we believe you have to take some spending cuts to this agency. You can't put $700 billion at a government agency and not expect waste to occur. So we wanted to make sure that we did not dodge taking spending out of DOD to deficit reduction. We do that. But having said all of that, I would love nothing more as a budgeteer to budget for a peace dividend. Here's the problem with that, Maria. We're not at peace. We are at war. And so there's only so far you can go before you actually start compromising the mission and the men and women who are out there valiantly serving our country. And so we don't have the ability to budget for a peace dividend when the world's become a more dangerous place. But having said all of that, we do cut defense. We do take $78 billion out of it for debt reduction, in addition to the $100 billion we take from other parts of the DOD to give to the troops. If we wait, if we allow these Medicare tactics to continue, seep in, demagogue, and inflict political paralysis in our system, then we're going to have a debt crisis. And you know what happens then, Maria? Austerity. Cuts to current seniors, cuts to people who depend on the safety net, tax increases that slow down your economy. The people who get hurt the first and the worst are the people who need government the most, the elderly and the poor. That's what we're trying to prevent. And so our spending is more targeted toward those populations. That's why we always say, fix welfare for people who need it, end welfare for people who don't need it. That's corporate welfare, that's spending on corporations, on the connected, and through the tax code. So I really believe we have to make a decision about our values. Who should be helped the most by government and who shouldn't? We think we should help those who are least among us, And the sooner you do this, the more we do it on our terms, the more gradual and sensible our reforms are, and the more we procrastinate, the deeper the hole we dig, the more painful and immediate the solutions must become.
Talk to us a bit more about how you envision governors taking over their own parts of the Medicare issue. Medicare data, this is from the audience, Medicare data shows where the health market works effectively. Could the Medicare program highlight the best markets?
Absolutely. Medicare Advantage is showing this. We've learned a lot through Medicare Advantage and the Medicare Drug Benefit Program where you have better market competition. And not all states are the same. So I've talked to several governors who asked us to block grant Medicaid because they believe they can make the program work better at a better price, at a better cost, if they can have more control over flexibility in reforming it in their states. I've talked to Mitch Daniels, Chris Christie, Scott Walker, several governors who are saying, give us the freedom and the flexibility to customize these programs because we'll make them work better. Right now, we're having problems with this program. On Medicare, it kind of comes down to this. Mind you, it's the biggest driver of our debt in the future. It's got tens of trillions of dollars of unfunded liabilities. Everybody acknowledges that. The status quo is the enemy of Medicare. It's actually the worst thing because that means collapse. And so does the money go to the government and come down through price controls and ration care, where we have a board of 15 people make all of these decisions? Or does the money go through the individual? More for the poor, more for the sick, less for the wealthy, and give them power in a marketplace to have competition. Do you want a centrally planned system, or do you want a system where the providers, doctors, hospital, insurance companies compete against each other for our business? Now, to make that work, you got to make sure that the person is powerful. They have money and they have rights. You got to clean up our insurance laws. Under our Medicare reform proposals, Medicare does the negotiating with insurance companies. Medicare sets up guaranteed coverage options from which seniors choose, and then Medicare subsidizes those based on need. That, to me, is a far better way to go. It's just like the system I have as a member of Congress and federal employees have. It's just like the way that Medicare drug benefit works, which came in 41% below cost. Medicare has a lot of experience doing this way, and we just fundamentally think it's a better way to go because it gives us the ability to guarantee that the benefits system, as it's now designed, is there for people who now rely on it. That, to me, is a better way to go, a patient-centered system where the patient has the power versus a government-centered plan system where you necessarily have to ration and control prices. Price controls don't work. We've tried them many times before. They produce lots of inefficiencies throughout the system and scarcities, and I just don't think we want to go down that road.
But according to health statisticians, 1/4 of Medicare patients account for 85% of the program's total costs. Many of these patients are receiving end-of-life care. So how will your health plan reduce the cost of treating these very sick people?
Well, so as I mentioned before, our health plan, it's a budget, and the budget resolution is broad architecture, and this isn't final legislation. Those are kinds of details that would be worked out, I would think. But in a concept level, you're right about those statistics. You want to have that decision not made by some board, not made indiscriminately by government. That is the decision that should be made by the beneficiary, their family, and their physician. And you want that decision to be made with all the information. And so when Pete Peterson's facing that moment, I think Pete Peterson should pay more for his benefit because he's a man of means, and other people of means should be making those decisions. Those who are least among us should have more coverage and support. Those who have more should pay more. And in those kinds of situations, there will be price exposure, and so they'll be discussing these things as families. This is an inherently personal thing. And the dignity of the human person is such an important overriding principle that we employ to these solutions. And the last thing I think we should do is have some kind of arbitrary board determine these things. This is something that should be left to the individual, the family, and the physician, and they should make a decision based on all the surrounding factors. And so I just think if you're going into an area the government shouldn't go to, if you try to just put some one-size-fits-all formula at end-of-care life issues.
Are there any other items that you want to ensure that the people understand are critical to getting the deficit down eventually to a surplus situation?
I'll make a political statement and then I'll make a policy statement. From a policy perspective, the sooner we deal with this, the better off we are as a country. GAO told us 2 years ago our unfunded liabilities, meaning the promises government's making to Americans that it doesn't have any money to pay, was $62.9 trillion. A year ago, they said it was $76.4 trillion. This year, they're telling us our unfunded liabilities are $99.4 trillion. Every year we stop trying to fix this problem, it gets that much worse, and the inevitable solution is that much more painful. Politics. I'm very worried, and it's pretty clear these days, that, and both parties do this to each other, that whenever you put out a reform plan to try and fix this problem, the other party uses it as a political weapon against you. And what they do, in this particular case with Medicare, they're shamelessly demagoguing and distorting this. We call it Medicare, to try and scare seniors. The irony of this is our plan actually preserves the benefit for current seniors, but trying to scare seniors and turning these things into political weapons, what that ends up doing is just inflicting political paralysis. That means nothing gets done. And that means we go farther down the path of debt. So the politics of this means we need leaders, leadership. What do leaders do? Leaders offer and propose solutions. We have not had that from our partners on the other side of the aisle. We've had press releases, we've had TV campaigns and speeches. We have yet to see an actual solution using real numbers that add up to fix this problem. And in divided government, and I do believe ultimately this will have to be bipartisan, but you can't have negotiations with just yourself. You need to have responsible leaders put ideas on the table. The President created a fiscal commission, which I was happy to serve on. He disavowed the fiscal commission. We put dozens of their recommendations in our budget. Then he gave us a budget which didn't fix the problem. Then he gave us a speech which still didn't fix the problem. And now we have another commission, the Biden Commission. We can commission ourselves to death. We just got to get out there and fix the problem. And I think leaders should put solutions out there that actually fix the problem, and then let's debate with each other about how best to fix the problem and compromise. You can't get to that point if you have political demagoguery. So my fear is political campaign strategies for 2012 have now seeped into 2011, and we're going back to our respective corners and we're fighting this out politically. With the debt limit, my hope is that we get a serious down payment on this issue. We get a serious down payment on spending and debt to buy us more time and space in the credit markets. And then if there are things that we just simply can't agree upon, I would like to think we could have a civil conversation based on fact about how best to solve this country's problems. The country deserves this kind of a debate. People are hungry for solutions. And I got to tell you, Maria, representing a district that voted for Bill Clinton, Dukakis, Gore, and Obama, I believe people are ahead of the political class. They're sick of the demagoguery. They're sick of the Medicare campaigns. They want solutions. They want answers, and they're way ahead of us, and I think they just deserve nothing less. And we're going to talk with Gene Sperling momentarily. Is there anything that you would like to say before we hear from Gene Sperling about the President's plan? That's a softball-loaded question, I guess. No, I'm just kidding. What is wrong with the President's plan? We're going to bring Gene Sperling out right now. What is wrong with the President's plan is it doesn't fix the problem. The problem is a debt crisis. It doesn't do anything to address the drivers of our debt, our entitlement programs. Where they do something, which is the IPAB, I just personally believe that putting a board in charge of these things is the wrong way to go. Even with all the tax increases in the President's plan, which I think will chill economic growth, it still chases higher spending, and it doesn't even come close to fixing the problem. My personal opinion, if you're going to put up a budget, it better be a budget that solves our problem, that gets our debt under control. We've done that. Nobody else has. Congressman Ryan, thank you very much. Thank you, Maria. Appreciate it. Good to see you. Thank you so much. Our next conversation is with National Economic Council Director Gene Sperling. As I mentioned at the top, Gene is at the center of the discussion on budgets and fiscal policy. No one has a more detailed knowledge of the administration's plan than Gene Sperling. Please welcome Gene Sperling. Hi, Gene. Good to see you.
Thanks, Maria.
You heard the conversation with Congressman Ryan.
Yes.
How does the President's plan differ?
The The President's plan differs in that it has at its fundamental tenets a sense of balance, that every category is on the table, and that you have to have shared sacrifice when you're doing fiscal discipline. Now, the President did put forward a very serious framework. It did $4 trillion in deficit reduction over 12 years. It was praised by Bowles and Simpson. It was praised by this organization, the Peterson organization, by virtually every validator. It is absolutely the case that Chairman Ryan's plan does get to $4 trillion quicker over 10 years as opposed to 12. But we think that that is appropriate because we want, number one, we don't want to phase things in at 9% unemployment in a way that in any way impedes our recovery. Two, we think it's very important that as you are trying to control entitlement costs, trying to control the deficit, that you don't stop investing in the future in terms of education, research, science, the things that are critical for our competitiveness. And third, we do believe it is more important to protect the fundamental social compact that we see in programs like Medicaid and Medicare. And we think that the President put out a very serious plan. It had Medicare and Medicaid savings of $470 billion over 12 years. It had over $1 trillion of discretionary spending over 12 years. It did have $1 trillion of revenues. So it had really a plan that did $4 trillion, $3 in spending cuts, including interest savings, for every dollar of revenue increases. But I want to hit the shared sacrifice point. I've been involved in several deficit reduction efforts, and here's the news. Nobody likes deficit reduction. The way deficit reduction happens in our country is when everybody dislikes it in a kind of equally, in a way that they think is fair. So it's very important, if you're going to even go into programs like Medicaid and ask for savings, if you're going to squeeze on discretionary spending in ways that deal with research and science, if you're going to do these things and ask for sacrifice, people need to know we're all in this together. So when we talk about things like why it's important not to permanently extend the high-income tax cuts, it's not just the numbers. It's not just the extra $1 trillion, though that's important.
Is it $1 trillion?
It is $1 trillion over 10 years to both extend the increase in the estate tax exemption and the upper-income tax cuts that are at dispute. $1 trillion. Now, the reason that's important beyond that trillion is look what's happening on the Medicaid side. You're going to cut $770 billion. $770 billion. You can't say to anybody who would be affected by that we have to do that. That we have no choice. We've had the greatest financial recession since the 30s. We've inherited a huge deficit and debt, and we have to deal with this. Because the fact is that all of those savings would be unnecessary if you were not funding the high-income tax cuts. So it's important for having the kind of moral power to ask everybody to sacrifice, that you include revenues in the package, and particularly revenues on the most fortunate. It's not about class warfare. It's about shared sacrifice, and it's about having the moral authority to ask everybody in the country to be part of an effort that is going to squeeze us a little in the short term and medium term, but for the benefit of restoring confidence in our long-term economic future.
I want to ask you about the IPAB mechanism, but we're on taxes.
Sure.
Let's stay on taxes for a minute. You just heard Chairman Ryan talk about what he sees are negative implications of raising taxes on anyone, and he said it was about economic growth. So talk to us about that. And you said it's shared responsibility, but we do have so many tax expenditures, and many people agree on both sides of the aisle that real tax reform is required rather than necessarily taking the highest earners up and taxing the way you're talking about.
All right, well, 3 points. Number one, I don't think anybody engaged in a serious discussion about our fiscal and economic future should make claims that what happens to the marginal tax rate at the top is going to be the sole explanation of whether we grow or not. I don't think that's a good idea, but I particularly think Chairman Ryan and others shouldn't try to make it from their perspective, because if you are going to look at that in that kind of more simplistic causal way, the evidence doesn't look too good over the last 20 years. Everything he said, I heard 9 million times in 1993, and then the next 8 years were 8 of the strongest years our country's had in the 20th century. Then we cut taxes significantly and had an administration that did not have one net private sector job growth. Now, I am not claiming that that is that simple. That's not my claim. I'm just saying I don't think it's wise for people on that side to make it because it's a simplistic argument and history doesn't help them. And the truth is that you're doing this as part of an overall fiscal discipline package. And if you do that, you will create confidence in your country. You will create confidence for people to make long-term investments because they believe we have the political will to compromise and do things that are significant to get our fiscal house in order and live within our means. And so I think that's very important. And, you know, I really want to point out how isolated the House Republicans are in their line that it's just a spending problem, not a revenue problem. I mean, that is good message discipline. It is not good fiscal discipline. If you look at any serious effort, 1982, after Ronald Reagan, tax cut was seen as hurting the deficit too much, Ronald Reagan was part of a tax-raising effort in 82. In 83, on Social Security. On 86, they raised taxes and cut others as part of tax reform. In 1990, President Bush and Speaker Foley. In 1997, the Republicans agreed to keep in and maintain the tax increases in 90 and 97. People talk about Cameron in the UK. Cameron has about the exact same proportion of revenue increases in his budget as we do in ours. So serious people doing serious discussions do not take an absolutist position that you cannot have a penny of revenue. It is never none of the bipartisan plans, the Peterson-Pugh plan, none of them take that position. 10 former CEA chairs, including people like Marty Feldstein and Greg Mankiw, all came out and said you need a mix of revenues. And so I think this is really holding back our chance to do something major because you can't get the sense of shared sacrifice if revenues are completely off the table, number one. Number two, it's hard to ask other people to do things perhaps on entitlements that they don't want to do or haven't wanted to do if there's no willing to compromise on the revenue side. And third, you know, there is a disconnect between what Chairman Ryan says about which I'm sure are his sincere intentions and what the impact his plans on Medicaid and food stamps would have for millions of not so fortunate Americans. And I think the reason that happens is he's put himself in a box. By having not be willing to do any revenue, even as part of tax reform, it forces them to do very severe cuts that I think if people explored, they would not be proud of. And that really goes to your last issue, which is we are very open to having a tax reform plan where you cut tax expenditures and you use some of those savings to lower rate and some of those to lower the deficit. That is what the Bowles-Simpson plan's been for. That's what most of the bipartisan plans. If we had that commitment, then we would have a balanced commitment that revenue was going to be part of the equation, and I think that would go a long way. But right now, we still have this absolutist position, even though every analysis of why we have a deficit problem right now certainly includes the long-expected aging of the population, but almost any analysis shows we have $500 billion a year of higher deficits because of the tax cuts in the Bush era that were never paid for. We support some of those, but we just need to be honest. There has been a revenue problem, and if we had paid for the tax cuts in 2000, we might not be having this conference right now.
Isn't there evidence? In fact, didn't Christina Romer do work on the fact that when you allow people to keep more of their income, they will spend it in the economy?
Well, there's no question that when you are trying to, put more spending into the economy in the short term, when you're trying to essentially have a Keynesian impact, that you want to give you want to put money out where it will be spent the quickest, have the highest multiplier impact. But actually, that argues when you are giving that type of tax relief to help the economy in the short run, to give money to those who have, as they say, the highest propensity to spend. In other words, when you're making $38,000 a year and you get an extra $500, you're probably going to spend close to $500 of that. It's going to get out in the economy and help. When you give somebody making $3.8 million an extra $500, they may not remember where they left the check. So that actually, again, argues more that when you're trying to do tax relief, you want to center it more on people who are living paycheck by paycheck. And that's what we've done by having the payroll tax cut for this year, which has been very important for economic growth, particularly with higher gas prices. And that's the type of tax relief we've pushed for people in the middle class who are more likely to need the money paycheck to paycheck and put it out in the economy and help us get higher growth.
Let's talk about spending cuts and your thoughts on Chairman Ryan's ideas on Medicare and Medicaid. The Affordable Care Act maps Medicare spending through the Independent Payment Advisory Board, IPAB, mechanism. Why do you think that the small group of people serving on IPAB could possibly make wise decisions about cost reimbursements in light of the enormous size and complexity of the healthcare market in the United States? Why is command and control the right approach for this problem?
So you might not shock you that I wouldn't have defined the question the exact same way that you did. So a couple things. Number one, it's good, we're talking about this IPAB issue, the independent board, because in the president's plan, which was not just not a speech or press release, but a plan, we put out levels of detail that included saying that in 2018 and beyond, we actually would tighten our focus on Medicare's growth by saying that where it was above GDP plus 0.05 per person in Medicare, that the IPAB would look for additional savings. So, first of all, we're having this discussion now about our plan because we have put out significant details. Look, here's the justification for it. A lot of people for years, Democrats and Republicans, said Medicare, unlike Social Security, is a little harder just to figure out what, combination of different adjustments or revenue adjustments you need, because healthcare is very dynamic. But unfortunately, we don't act as much because it has often been caught up in the political system. So the idea was to try to create a more independent, non-political way of dealing with that. And there's been a lot of accusations of demagoguery, but if someone doesn't like that idea, let's have another suggestion. But the basic idea of bringing more expertise into our system, more independent expertise to help adjust Medicare as we learn more about quality and delivery system efficiencies in a way that doesn't have to go through two houses of Congress all the time, doesn't have to be subject to all the politics, was, I think, a very well-intentioned and, I think, smart idea. And if it's not the best idea, then let's hear something. I think one of the most unfortunate things going on right now has been the complete politicization of the Affordable Care Act. President Obama does not sit around and say, boy, we're going to defend every little thing that we've done to the T. He would welcome constructive criticism or comments about how we could do things better. But we have a health care spending problem in our country, and we put together a very thoughtful effort that tried to take all of the type of reforms, whether affordable, the comprehensive care, the different payment systems, the IPAB, and these things right now have just become political fodder. So part of the reason we're not having, so I agree with Chairman Ryan on one thing. We should be able to have more serious discussion about the specifics of our plan, and I think it would make it easier for us to figure out what we agree and disagree on and how we can make progress.
So walk us through it. Let's have that discussion. What does Medicare and Medicaid look like over the next 10 to 15 years?
Well, let me just say something, and you can watch me. I will use no phrases, nothing. I'm just going to describe why I, as a policy person, have concerns with Chairman Ryan's plan based on the Congressional Budget Office analysis. Most of what you hear in the discussion is the fact that, as you mentioned, a beneficiary in 2022 would have to pay $6,400 more than they would in the current system, $6,400 more, and that amount grows with time. That's where most of the discussion's been. Let me go to another part of that calculation. What that same Congressional Budget Office analysis shows is that overall, under his plan, as analyzed by Congressional Budget Office, we will spend $5,700 more per Medicare recipient. So let me just make sure everybody's clear on that. The goal of most health reform is not just to shift from one side of the ledger to the other, but to see if we can do reforms that lower the amount we as a society spend on health care. His plan by CBO would would mean in 2022, instead of all of us together spending about $14,000 per Medicare recipient, it would be about $20,000. We'd be spending $5,700 more per Medicare recipient. Now ask, how much is the government saving? The government saves about $615 per recipient. So I hate to use so many numbers, but here's the basic deal. It does not show that we are spending less. It shows that by having the private sector involved in this, that you end up paying extra for the administrative cost, the underwriting cost, the advertising cost, the profit cost, and you're basically saying that we're going to pay this much more. Mostly, the recipients are going to pay $6,400, and for what cause? So that the government can save $615 per recipient? Now, that's not my analysis. That is the Congressional Budget Office. Chairman Ryan says, you know, maybe it'll be more efficient. Okay. I'll give it to him. Let's say it's 10% more efficient. It still makes very little sense. And so I think you have to look and ask, is that the type of reform we want? And do we feel comfortable changing the entire structure of Medicare from something where there's a bit of a basic package that people can count on to something completely very new? When the Congressional Budget Office, at the chairman's request, analyzed their plan so it could come out on the same day he announced it, and found that it was going to mean that we as a society were going to spend $5,700 more per Medicare recipient in 2022.
So what is your plan?
So our plan, we do a few things. First of all, we are involved in serious discussions that are going on right now as part of the Biden group, and we're willing to look line by line through many of the traditional savings that have been put forward by Congressional Budget Office, by many of the bipartisan groups. We, for one, would use more leverage in terms of on the purchase of drugs. We think there are still savings that we can get in efficiencies in our payment system, and we've committed publicly that we're willing to do $470 billion of Medicare and Medicaid savings over the next 12 years. And the IPAB does do something which we think is important. It means that we may not have it all right, but we're going to set up an independent body of authorities. 6 of them would be chosen by Republicans, 6 by Democrats in the Congress, and that this group of experts would look on a year-by-year basis, and if Medicare spending was growing too much, it would never be on automatic pilot again. A group of experts would be forced to present options to the Congress that they either had to act on or be implemented. Again, maybe that could be done better, but it does not deserve the kind of disparagement it has. It's a very serious proposal, and maybe there's a better way to do it, and we're all ears in trying to have that type of bipartisan discussion.
If the current health care law is effective, why are there so many waivers? Are there 1,000 waivers?
Are you talking about for Medicaid or for Medicare?
No, the health care law.
Well, I think when you're doing, any kind of things, we've always had this federal system where we try to create systems for our countries, and we've always had options for flexibility, and that's part of the laboratory of democracy that we have in our country. So in Medicaid, for example, people can apply for 11, 15 waivers, and that can give them the ability to experiment, have more authority. But we make sure when that's happening that it's not going to mean less coverage for very poor people or things that are destructive. So again, I think the fact that we have waivers, that kind of flexibility, is a positive, not a negative. It shows that we're not trying to do one-size-fits-all. And so, for example, on the exchanges, we've said that if a state can come forward with a different system that they think is better and covers the same number of people, they can do so, which again shows that this really is about, whether somebody else actually has a better idea or whether they simply are deciding that it's okay to not cover 34 million Americans going forward and continue to have those costs shifted to hospital, shifted to premiums as hidden taxes. I mean, our status quo on health care is not acceptable, and that is why the Affordable Care Act is the right thing to do. And I think, again, our goal as an administration is not just to have every single thing exactly as we designed it the moment it passed. What we would like is to have a constructive conversation where people recognize that we have put into this virtually every good idea people have had for more coordinated care, for more efficient care, for aligning payment with the right incentives, not rewarding or letting hospitals get away with readmissions that are completely unnecessary. These are all the good policies. If we didn't get it exactly right, let's have a discussion about it, as opposed to deciding you're going to name something repeal the job-killing Health Care Act and make that simply a political soundbite, a political message, when we're supposed to be talking about this important issue. And if you think this is separate from Medicare, it is not. Let's be very clear about one thing. The main reason that Medicare's costs are going up in our country, spending, is that we have had the long-awaited aging of our population. In 2020, in 2000, when I left as NEC director under President Clinton, there were 45 million people on Medicare. Today, in 2020, there will be 70 million, 25 million more. That is going to increase costs. That's why we did all the fiscal discipline in the 90s, so that we were ready for that. The growth for each enrollee is about 2.92%. That is lower than the growth of healthcare in the private sector. So if you're not doing the type of things that is bringing down costs in the overall system, you are likely to be back to the game of shifting costs from one party to the other, instead of us as an economy trying to figure out how we can spend less overall.
It's just worth noting that the costs have been so significant for companies and other institutions that they have balked to the extent that they have actually received waivers, a significant number. But let me move on to Social Security. Why didn't you attack Social Security?
Why didn't we
attack Social Security in terms of trying to cut Social Security services over the 10 to 12-year period?
Look, I would say it's pretty clear the Obama administration is a bit the person in the middle on Social Security. There's no question that we have some people, many of the groups that we support and work with, who would like us to take Social Security completely off the table. We have, unfortunately, most of the Republicans, virtually all, so far saying that they will only do Social Security reform if you do the entire reform by cutting benefits. That's not how Tip O'Neill and Ronald Reagan did it in 1983, and that's not how it will ever get done. So I think that the President made clear in the State of the Union, he made clear in his, when he laid out his $4 trillion deficit reduction plan, that while we do not think Social Security should be used as a device that's designed to lower the 10-year deficit, that we do think we as a country would be better off dealing with protecting its core purposes, its rock-solid progressive benefit, and its solvency earlier as opposed to later. And what we're really looking for is folks from the other side to be willing to come to the table without this ideological, not a penny of revenues, and talk about how we could do this in a balanced way, doesn't slash current benefits, still protects those with disability, still keeps it a rock-solid benefit. So we have not taken it off the table, but this is an area where we need those who could help pass this to be willing to have a balanced conversation about it.
And to be fair, Chairman Ryan also did not attack Social Security as I referred to it earlier. Defense spending cuts.
So it is true that prior to the President's recent plan, that our defense budget actually increased the deficit by about 180, 190 billion dollars over the 10-year window. We have now put out a budget target that actually reduces the deficit, reduces spending, so it reduces deficit by 290 billion. So that's a over $450 billion swing. So we've made a pretty serious move on defense spending, and I think we're doing so because we recognize that you just can't have this kind of comprehensive deficit reduction effort, a sense of shared sacrifice, if you take any major area of the budget and just say it is completely off the table. This is difficult. The President's the Commander-in-Chief. He's not at a think tank. He has to work this through in a very serious way with his Joint Chief of Staffs and Secretary of Defense, but we've made a pretty significant commitment recently, which is one of the reasons we were able to get to $4 trillion over 12 years.
Ryan's team says Bob Gates has said that your spending cut proposals are not viable.
Well, you know,
Have you heard Bob Gates weigh in on this?
I am, the President and Chief of Staff and Vice President have had many conversations with the Secretary of Defense, and I am party to some of those, but I'm not going to discuss them here. I think we're all on the same team, and I think he understands that defense has to be part of the overall effort to get our budget under control.
Okay, let me get some questions from the audience, and this is from Michael Pierce of Wyoming. As a father of a child with special needs, my family has benefited from government social programs. Nevertheless, when does our debt reach the level where good intentions today become crushing burdens on the next generation tomorrow?
So I think that's a great question, and I think that spirit in that question is really touching in a sense. This is a person who has a child with special needs, and yet they're suggesting they're willing to be part of the shared sacrifice. But I have to say there are right ways and wrong ways to do things. And I'm just going to say from a policy perspective, and I say this to everybody in this room, there is enormous discussion about the revenue side and the Medicare side. But from a policy perspective, from a values perspective, we should be very deeply troubled by the Medicaid cuts in the House Republican plan. I want to make clear what they are. This is not my numbers, this is theirs. After they completely repeal the Affordable Care Act, which would take away coverage for 34 million Americans, according to the Congressional Budget Office, after they've completely repealed that, they do a block grant that would cut Medicaid by $770 billion. In 2021, that would cut the program by 35%. Under their own numbers, by 2030, it would cut projected spending in Medicaid by half, by 49%. So, of course, I don't think or imply any negative intentions or lack of compassion, but there is a tyranny of the numbers that we have to face. And here's the tyranny of the numbers. 64% of Medicaid spending goes to older people in nursing homes or families who have someone with serious disabilities. Another 22% goes to 35 million very poor children. Now I ask you, how could you possibly cut 35% of that budget and not hurt hundreds of thousands, if not millions of families who are dealing with a parent or grandparent in a nursing home or a child with serious disabilities? How is the math possible? If you tried to protect them, mathematically, you would have to eliminate coverage for all 34 million children. Now, I know some people didn't like when the President mentioned that this was going to be very negative for families, for those amazingly brave parents, and he may be one of them in our country, who have a child with autism or Downs and who just are enormously committed and dedicated to doing everything they can to give their child the same chance every other child has. But here's the reality. Medicaid does help so many families in those situations. Over the years, we've allowed more middle-class families who have a child with autism to get help in Medicaid. There's a medical needy program that says when you spend down, will will count the income after you've spent down medical costs. There's a Katie Beckett program that was passed by President Reagan that says if you have a child that's in need of institutional care, you can get help from Medicaid. This is a life support for many of these families. But these are the optional programs in Medicaid. These are the ones that go to more middle-class families. If you're going to cut 49% of projected Medicaid spending by 2030, do you really think these programs will not be seriously hurt? So when we say that the tyranny of the math is that this Medicaid program, this Medicaid cut, will lead to millions of poor children, children with serious disabilities, children with autism, elderly Americans in nursing homes losing their coverage or being or having it significantly cut. We are not criticizing their plan. We are just simply explaining their plan.
Jean, one more question from viewers from Andover. Won't putting America back to work help reduce the deficit?
You know, absolutely. And I think when people talk about the efforts that were done, I mean, let's understand what happened. We inherited a very, very deep deficit. And there's no question that we took efforts through the Recovery Act to add money temporarily to the deficit to help get our economy back. But we don't think those increase the deficit or the debt. We think they help prevent us from going into a prolonged deep recession or even a depression. So of course growth is important. And we're at a point right now where we have 9% unemployment, we have private sector job growth strengthening, but not good enough. And so we have to do this the right way. We have to do it with balance. We need to be able to say that, that we are giving confidence to investors and people who create jobs around the world that the United States is still a good place to invest because we get our fiscal house in order. We're willing to implement significant cuts and select revenue increases to do so, but we do so in a way that's phased in and doesn't hurt our economy, because that would be counterproductive. And secondly, and I just want to make just an overall point, because I think it's very important. For so many people, like Pete Peterson and others, who have devoted themselves to us dealing with the baby boom retirement, the long-term entitlement, part of the theory behind us dealing with us is that we didn't want to be a society that spent so much just on older Americans that we lost our ability to invest in our children, in education, in the science and research and innovation that's important to our future productivity. It was very much that type of thinking that led so many people to want to deal early on with the aging of our population. But what is happening right now is there's become a very, I think, unfortunate desire to simply cut domestic discretionary spending across the board to unprecedented low levels, even though this is the area where the National Institute of Health is in, the National Science Foundation, Pell Grants, Head Start. We need to do fiscal discipline going forward, but as the President said, you don't unload a plane that's loaded up too high, needs to have some weight taken off it, but you don't take the engine out. So we need to have a balanced plan that does not take our levels of domestic spending to such low levels that it might sound good for press releases, it might sound good, but where we are actually defying the one of the fundamental goals of dealing with our long-term entitlement situation by actually failing to invest in our children, failing to invest in research, medical research, innovation. And I think that's very, very important as we go forward.
Which aspects of Chairman Ryan's plan would the administration be willing to incorporate to get the Republican buy-in?
Look, I think there's places that are very difficult for us to go to. I think the hardest really, when you look at Medicaid block grants and food stamp block grants, those are things that I think would be very, very difficult for us to ever support. Number one, we think it takes away the basic social compact. in those programs that would lead to the type of very unfortunate cuts we just discussed. Secondly, I don't think they're wise economic policy. The Federal Reserve estimates that the fact that we have what they call automatic stabilizers, things like food stamps and unemployment insurance and Medicaid, that where we increase spending as we go through recessions or more people go into poverty, helps smooth out our business cycle, our recessions. Doing them in block grants not only will be bad for some of our most hard-pressed Americans, it will also be, I think, unwise macroeconomic policy because it will reduce the automatic stabilizers in our economy. So I think that those kind of block grants are difficult. We are open to talking about many ideas on the Medicare, but for the reasons I've discussed, I think the current House Republican Medicare plan is just very, very poorly designed. I mean, it just, to make beneficiaries pay $6,000 more so that the government can get $615 more in savings. You know, that's what people say about my basketball skills. He's slow, but he can't jump. It puts a lot of cost on beneficiaries, but it doesn't save much for the government. So I think that when you're doing, if you want to go into the areas of reform, you have to do so carefully, and you have to be not upset basic guarantees that I think are important to our safety net. But look, we have basically agreed to a level of domestic discretionary savings that are consistent with the Bowles-Simpson plan. We have put in a level of Medicare and Medicaid plan savings consistent with the Bowles-Simpson plan. The only two places where we don't go as far as they do are on defense, and they actually do more revenues than we do. So we are the ones that are very close to the bipartisan fiscal plans. We have a balanced plan. We're taking nothing off the table. Look, you know, what I hope is, I think Chairman Ryan you know, he's somebody I like very much personally, and I think he has a lot of sincerity. But I think what's happened is that in their desire to live by what is an ideological view that you can't have a penny of revenues, it forces you to do things like the Medicaid savings that when you look at the details of, I don't think many of the people who voted for them would really support if they understood the full implications of.
Gene, final question here. What are the administration's fiscal goals, top priorities this year, and how will you achieve them briefly?
I think that at the moment, you know, I think the most important fiscal goal, and this is one place where I think I agree very much with Chairman Ryan said, we have to get a down payment now. A lot of what people judge around the world is not that they say, you know, I don't know that people, when they look at what gives confidence in our economy, says, oh, if it's at 2.2, we have confidence. At 2.8, we don't. I think they look and ask. I think they start with the view of enormous confidence in the United States. We are fortunate. People have a positive bias towards the United States. We are, even in an ugly economy, we're often the prettiest kid in the room. We're often the safest haven, even when people are most roiled around the world. So we have something very special, and we need to protect it. That's why you can't play games with things like a default. You just can't play games. It's a treasured asset that we inherited from Alexander Hamilton, that U.S. credit standing, our credit worthiness, our full faith in credit is something that is the gold standard. You don't even want to get near doing anything that would in any way lessen that. And on the fiscal discipline side, I think what people would like to see is that even with the types of division we have, we as a country are capable of coming together and doing something serious. If we got a serious down payment on deficit reduction in the summer of 2011, I think that would have been way above the expectations that people would have had in November when they saw we were going to be in a period of divided government. And my guess is that a serious down payment isn't going to get you all the way there, but the path to deficit reduction doesn't always happen all at one time. And to be bipartisan, you know, President Bush, the older President Bush, started in 1990. He didn't go far enough, but President Clinton bravely put forward a plan with no Republican support in '93, And then in '97, dealing with Medicare, two incredible adversaries, Newt Gingrich and Bill Clinton, came together. So I think what people need to see is that we're on the right path. So I think getting a serious deficit reduction package, which means looking for the areas we agree on and trying to press each side to move a little bit from long-held positions so that you hold hands and jump together and do something that's politically difficult for each to do alone, but together is politically viable and is economically important to the country. That would be the most important thing. I think that would be enormously confidence building. And I will say that I'm fortunate to be one of the people at the table for the Biden discussions. And if you're in that room, you would really be struck by the seriousness of purpose, the degree people are going line by line. And I think there's trust building up. I didn't know Eric Cantor very well before this and probably disagreed on virtually nothing with him. But you sit in a room and you have discussions, and everyone, including Congressman Cantor, comes very well prepared, ready to talk specifics as opposed to giving speeches. And I can't tell you that this Biden negotiating group is not a commission. It is a negotiating group with people selected by the leadership to negotiate. I can't tell you we'll get all the way to the finish line, but there's a real seriousness of purpose in that room that gives me some optimism.
Gene Sperling, thank you very much.
Thank you.